90-90 alternating crossovers with IOs and TAs. This technique has been used with permission from the Postural Restoration Institute, recorded by Dr. Sarah Petrick, physical therapist with Restore and Rebalance, LLC. The goals of this exercise are to teach a patient how to coordinate their stance leg hamstring and IOs TAs for stabilizing the pelvis of the stance leg during gait. It also promotes upper trunk rotation without losing lower trunk stability and promotes air expansion in the back ribs of the reaching arm and upper chest of the contralateral arm. Now, to get started, you're going to want to build a ledge for your heels to pull down into. And I like as narrow of a ledge as possible. I used a few blocks I have at the clinic. Lie on your back with your feet up at a 90-degree angle with a pillow under your head and upper shoulders. I rolled up my yoga mat. Then we're going to posteriorly tilt your pelvis by pulling your heels down into the ledge. Attempt to keep your back and abs relaxed so it's easier to sense your hamstrings do the tilt. This creates a decompressive posterior pelvic tilt of the innominate bones versus a compressive counternutation sacral tilt. To check whether you're doing a posterior pelvic tilt correctly that decompresses the spine, you should note that you should feel a relaxed back, relaxed abdominals for now, and then your hamstrings are engaged. If only feeling the hamstrings behind the knee, you're just using the distal hamstring for knee flexion. In that case, you might try this without the ledge, or imagine the knees reaching up towards the ceiling during the pelvic tilt. Now, on with the exercise. You're going to kick your right leg up in the air, keeping your left heel pulled down into the ledge. Reach your left arm and hand towards that right foot. Exhale as you reach higher and attempt to keep your breath out for at least 3 seconds. Then inhale, keeping your hand at the same height. Repeat that breath sequence, exhaling, pausing, and then inhaling for 3 to 5 breaths. Then lower your left arm and place the right foot back on the ledge, pulling it down with your hamstring so that we can repeat on the other side. Then you're going to kick the left leg up in the air, keeping your right heel pulled down. Reach your right hand towards your left foot, exhaling as you do so. Stay there, holding your breath for at least 3 seconds, and then inhale. Repeat that breath sequence for 3 to 5 breaths, reaching farther every time you exhale. Repeat this again on each side for a total of 3 to 5 times. Now, during this exercise, patients should sense their back and neck relaxed, hamstrings working, abdominals working, and the pressure on the heel that is pulling downward. Air should expand during inhalation into the chest of the non-reaching arm and/or the back ribs of the reaching arm.